joining us now to talk more on this in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Thanks so much.
So, where is Canada currently at in terms of infections, Dr. Raut?
Right. So we can actually talk even on a global level. If we're looking at global COVID levels, we've seen a good decline in the last few weeks, cases dropping about 11% and deaths declining about 18%. So Canada is definitely following that trend. Majority of Canadians at this point have caught COVID-19 since Omicron, and we've seen a lot of that immunity that's present as well. The estimates are suggesting that almost two-thirds of us have had COVID-19. So what we're seeing is adults, especially with about 60 to 70% of adults less than 60 have had some sort of prior infection, and 40% of adults above 60 having some sort of infection as well, which is much higher than before, which is only 15% in March. So all to say that I think that we are at a stage where there is a level of immunity, perhaps herd immunity, that is going to help us into further waves there.
Now, staying on that note of immunity, Dr. Raut, we mentioned that Omicron subvariants are able to surpass previous infections. So, considering all of that, what are scientists keeping their eyes on as we head into the fall and winter months?
I think what we need to do is keep in mind that we do have these two new variants coming in, so BA 275.2 and BQ 1.5. And what we've seen with those is that they have some level of evading. Now, how much, we're not entirely sure yet, but there are some studies from Sweden that's been found to show significant ability to evade immunity from antibodies in the population. Despite all of that, though, remember, these two subvariants are still just a very fraction of all total infections, Canada being mostly 85% BA 2.5 at now. So virologists are concerned, but they would still need to see where those subvariants go in terms of the greater population.
And do we have any more information about the effectiveness of boosters on these particular subvariants, Dr. Raut?
Right. So what we know is Canada did approve this updated bivalent COVID-19 vaccine. It's supposed to target both the original virus and the original Omicron BA1. And the idea behind double targeting like that is it would help prevent future waves. If we look at subvariants, they seem to evolve from previous variants. So if we get protection from these previous, it can help with subvariants. As an example, at least the studies are showing that this bivalent vaccine should have high neutralizing antibodies against BA4, BA5, as well as, if we remember, the alpha, beta, delta, and gamma variants of COVID-19. So we think it should help reduce the risk, but of course, we're still seeing the data come in.
All right, Doctor, I'm going to ask you a tough question here, but how likely are we to see another wave of infections this fall or winter? What are your thoughts on that?
Right. So I think what we're seeing is mandates are dropping across the country. People are making their own decisions about masking. And this combined with these new two subvariants means likely we will see more infections. In the past 2 years, the cases of mutating disease spread very quickly in the fall months, and many require treatment in the hospital. So I think we will see that jump. However, I think we're going to see that it's going to be less of a burden overall.
All right, Doctor, it looks like we've got about a minute left here, but what is still not known in this ongoing battle against COVID-19?
That's a good question. So if we're looking at even the new cases that are coming in, we do expect case counts to rise. We do expect people test positive for COVID-19. We see the evidence of that in the wastewater systems as well. But the real question is, what does that translate to? So far, we're seeing that there are fewer patients in intensive care units and fewer patients who are hospitalized. So we may reach a state where we are getting multiple infections, but minimal hospitalizations and ICU ventilators and the rest requiring. So if that's the case, we really need to flesh out that data to see where exactly the COVID-19 pandemic would go, and would it turn more into a mild influenza at that point.
All right, lots to keep our eyes on. Dr. Raut, thank you again for joining us today on Forum Daily.
Thanks so much for having me.